scan. S1. L5.
Hey everybody, I'm just doing a EMG rescan today. So for all of our patients, we like to reassess them even when they're feeling better to make sure that there's not new patterns of high tone or muscle guarding going on. It gives us a lot of good information on how well they're responding to their normal levels of stress, also on how well they're acclimating to care, because they might, let's say someone's coming in and they've had problems with sciatica, or they're having a little trouble when they go to the gym or exercising, and they're 2 weeks in, the numbness is already gone, they're sleeping better, they're feeling so good, but maybe underneath that, they're really only measuring about 10 or 20% better. So then they wouldn't be ready for that next level of pushing a stretch or an exercise. Whereas when I can go in and run these tests and confirm that the measurement is matching what they're feeling subjectively, now we know we're ready for that next level. It's one of the reasons I love this test. We don't have to guess.
C5. Left. C1.
Yeah, so here's an example. Again, I just used my son Nico today as an example, but we're doing this, 7, 8, 9, 10 times a day in our office for patients that come in. Some are new, some are coming in for wellness, some are coming in for performance-based. In Nico's case, where he scored the highest was in his low back and up around the neck region. Most of his looked pretty good. So a typical maintenance performance, someone we see on a regular basis, they score really well. It's very hard to be perfect. So I know today he's got a couple spots that are not necessarily massively overwhelmed, but enough to where if he was going to play at his best or recover fast from practice or a game, it's going to recover better if those areas weren't so taut or guarded. So we'll focus on those adjustments today. Again, I just love the exams because it helps us to be a little more specific rather than just basing it on how good do I feel today. That's not enough. Everybody, we're going to demonstrate an in-body exam. It's where when you come in, if you want to know exactly how much muscle, fat, and water you have in your body, it's a very accurate exam, so we're not guessing. Far too often we're making health decisions based on our total weight from a scale in our bathroom, which isn't giving us a lot of specific information. So for our patients, I like to know the detail so I can give them better health and wellness advice. Nico, want to show them how easy it is? So it has these 8 different sensors. First thing it'll do is look at total weight. Again, we have the gowns. In this case, Nico has his shirt off, but if someone wants to wear a gown or leave their pants on, that's fine. The total weight will be affected by that by a pound or 2, but again, that's the least important part of the information. Just put your phone with the area code.